Dr. McCullough, please, in my layman's terms, I just kind of laid out the harmful mechanisms of this injection. Can you and Dr. Vaughn, because I think you've both spoken to this, again, in layman's terms, talk about why this caused so much harm in so many different ways because of the biodistribution. Dr. McCullough.
80% of Americans took a vaccine. 20% didn't. 20% did not take a vaccine. The vaccine was never safe enough for me to take. Messenger RNA, devised by Pfizer and Moderna, has been chemically modified to be unassailable to enzymes in the body to be broken down. The messenger RNA is found in the human heart of people who die after the vaccine. It's found in the brain. The spike protein is found everywhere in the body. 3 studies now show the spike protein is circulating in the blood for 6 to 9 months after people take the shot. This part of the virus, the lethal part of the virus, in the vaccinated, it's circulating in the blood. And then they take a booster, they get more circulating in the blood. It is a killer protein. It cannot be safe. It was not safe by design. Safety trumps efficacy. We cannot tolerate false drug claims. And we saw a poster behind Senator Blumenthal making a false drug claim that vaccines saved millions of lives, specifically the COVID vaccine. Well, let's take a look at that. When someone signs consent for a vaccine, Senator Blumenthal, does the consent form say it's going to save their lives? Of course it doesn't. It's not on the FAQ. There's never been a prospective, randomized, double-blind, placebo-controlled trial ever showing that COVID-19 vaccines reduce mortality or hospitalization. There's not even a valid non-randomized study. Thankfully, COVID mortality went down for 3 reasons. Because we all got the infection, vaccinated and unvaccinated, so we developed population natural immunity. We developed early treatment. Credit to Operation Warp Speed. We used all the Operation Warp Speed tools, additional drugs. We treated patients with multi-drug protocols at home so they don't go to the ER. So Governor Green never saw the patients we treated because they were successfully treated at home. And the third reason is the virus mutated to a much milder form. Those things happen concurrently with rollout of the vaccine. The vaccine cannot be falsely credited with saving millions of lives. We can't allow false drug advertising to be put up on a poster behind one of our public servants. We cannot accept that.
So let me quick. And I will have a lot more. I will have a lot more questions. Put up my that optional chart number 4 here, because I think this is something I developed. September 2021, and this shows the number of daily cases of COVID, and you see it's peaking in January. Right as we're rolling out the vaccine, but we really haven't injected it with anybody. If by the time we had any kind of significant uptake of the vaccines, we were way down in terms of the number of daily cases. I mean, this virus was burning itself out. Okay, now we had different variants. Again, I've read a lot of information about vaccination into the midst of a pandemic driving variants. Is that what happened? I don't know. But you would think if a vaccine were that effective, the tail would just continue and the pandemic would be over. But that's not what happened. We had a whole new surge, and this is Delta, and doctors I've talked to, a very deadly, probably a more deadly. Would you agree with that, Dr. McCullough? Delta was a more deadly. I know you guys are kind of freaking out that your early treatment wasn't working as well.
It was definitely more difficult to treat. But fortunately, by that time, we had treatments.
But anyway, I just wanted to put this thing up here again. To a layman, if the vaccine really worked, was that efficacious, to prevent all that disease? By the way, they all admitted that it didn't prevent transmission. They lied to us about that for 4 months, maybe a year. Then they finally had to admit it didn't prevent transmission. But again, this chart right here just shows you that if the vaccine really would have worked, you wouldn't have had this. You wouldn't have had this. But I'll turn it over to Senator Blumenthal.
Thanks, Mr. Chairman. And I think we'll try to certainly stay within our 7 minutes so our colleagues can have their day of questioning.
But again, we'll have second, third, fourth rounds. I mean, we'll use up the time of this hearing room.
The debate here seems to be about the efficacy of COVID-19. But the central issue that brings us here today is the allegation that there was purposeful concealment of knowledge and evidence. And I just want to make the point, I may be sounding a little bit like a lawyer, not a physician, but purposeful concealment, intentional hiding is essentially undocumented by the evidence released by this report itself. In fact, the documents released by the majority today show that public health officials took multiple steps in the spring of 2021 to make healthcare providers aware of those rare reports of myocarditis among vaccine recipients. On May 14, almost 2 weeks before the CDC decided to issue clinical considerations rather than a HAN on myocarditis, which is, by the way, the primary piece of evidence that the majority cites in this so-called cover-up. The CDC's National Center of Immunization and Respiratory Disease sent an email to state and local health departments around the country entitled, quote, "Monitoring Reports of Myocarditis," end quote. The email noted risks and contained a reminder that providers were obligated to report cases. 5 days later, they sent out a follow-up email urging recipients to let providers in their region know of risks and reminding them once again of the obligation to report cases. I have 2 emails here that are in the majority report. They're available to the public. I ask that they be made a part of the record, Mr. Chairman.
Objection?
I'm not going to read them. They're for everyone to see. One begins with, "I would like to flag a message we sent out late Friday night. I encourage you to forward this important message about vaccine safety and reporting," and it goes on. Warnings. Far from a cover-up, these public health officials were trying to alert scientists, doctors, the public about the potential side effects.